I always feel like I didn't choose Nepal. Nepal chose me. And my first visit there was, I guess, in 2010. And I was part of a trip that met in Nepal, continued to Tibet. And I remember my first sight of Nepal coming out of the airport and looking at cacophony of people, cars, rickshaws, motorcycles, electrical wires, color, sound, noise, but just so much beauty and happiness and big smiles on everybody's face. And I thought, wow, I've never seen anything like this. This is amazing. And so Nepal is a kind of magical place. I'm Janet Galipo, and I'm a part of this trip along with Holly Stefflig and Lama Glenn Mullin, and then of course Dr. Sherab and his wife Pema, who sponsored us in Kathmandu, as well as all of the other practitioners who were on the trip. There were a total of 15 of us traveling, in addition to Lama Glenn. Out of the 15, we had 12 medical practitioners. So these are people who had some kind of a healthcare skill. Being there and seeing the way that the Nepalese and Tibetans live in Nepal. These people are poor. They're so poor. The average income for a working family is about $350 a year. So they don't have anything. Everybody, lives in one room, eats in one room, sleeps in one room, but they're happy. They're happy people, and there was a joyousness to the people, and everybody would greet us wherever we went with big smiles on their face. Namaste, namaste, which is the Nepalese Indian greeting, or in the case of the Tibetan community, tashi delek, and with big smiles. And everybody would look at you, would meet your eyes, would give a bow, would give a smile. And I think for those of us who live in the West, who have so much, but are not necessarily happy, are still searching for something else, it was really an eye-opening experience for most of those people. And I've seen a few of them since we've been back from the trip, and the people on the trip have said, my life has changed.
Okay, good morning. So we're at a Tibetan Hall Community Center for Tibetan refugees in Boudha Stupa, Kathmandu, and we're here for our first day of the clinic. Hello, here we are, day one, getting ready to start our first clinic. We're in Kathmandu, and as Janet said, we have lots of people waiting outside, so we're going to get started.
People coming, and it's wonderful to see when they leave and they get up, they have much brighter spirits. And but some of the cases very complex and need lots of extra help and support. So it's wonderful that we have Dr. Sherab here to help us, so we can give direction and bring ideas for them to help support people in the long term after we leave. So it makes it sustainable.
In the past, I had helped on some of my pilgrimages that I led through Nepal and Tibet. I had helped organize clinics in underserved areas, you could say, often in Tibet and sometimes here in Nepal. And needless to say, it's very exciting for local people to have any kind of medical attention come to them if they're in areas where there's either little or no medical services, or alternatively, if it's in an area where the medicines tend to be more sort of the Western formula style, take blood pressure and give some pills and hope for the best thing. So about a year ago, Dr. Janet approached me and asked me about help put together a series of clinics for her and Holly and their circle of friends and healing friends.
For us to be able to meet them and to treat them was, a joy and a privilege for us, and they were so happy, so thrilled to be able to receive those sessions. But I have to say that I think the people who benefited the most were the people who went on the trip. Happiness is not something ready-made. It comes from our own actions.